Hi, welcome to the Physio Files. My name's Graham Nelson and I'm from Northwest Physiotherapy Group. Today we're talking about knee pain, particularly pain at the front of the thigh, or sometimes known as anterior knee pain. Now this is the second part of our series on top 5 causes of leg pain. And you may remember from last time we spoke about lateral knee pain, or pain on the outside of the knee, caused by iliotibial band friction syndrome. So my partner today, Russell Visser, will talk to you about anterior knee pain and some of the causes and how you can recognise it. The aim of this is just to inform you and educate you about your musculoskeletal health and help you make informed choices to maintain optimal health.
Hi, my name's Russell Visser. Thank you, Graham, for that introduction. Today I want to talk about anterior knee pain, which is a fairly common affliction affecting the leg. So anterior knee pain, or Patella femoral joint pain, is related primarily to problems with the tracking of the kneecap up and down on the femur. Now it's felt usually at the front of the knee and sometimes on the inside or the outside, and occasionally at the back of the knee. But generally it's all because of uneven wearing and irritation underneath the kneecap.
So Russell, why is the tracking so important with the knee?
Good question, Graham. The tracking is very important in the knee because the kneecap or patellofemoral joint is a unique joint because it's not actually enclosed in a stable joint. So the kneecap actually moves up and down as you bend and straighten the knee, and so if we have incorrect tracking, you can actually get uneven wearing under the kneecap and start to get some symptoms.
So Russell, how does someone know they've got this problem?
Well, Graham, generally what will happen is you'll develop this pain, as I've described before, through certain activities that load up the kneecap. So if that kneecap is pressed against the femur with certain activities such as crouching or sitting for prolonged periods of time, or kneeling, going up and down stairs, or running, any activity that actually causes sustained pressure of the kneecap, that is a problem. And so that's what we need to be aware of. And the other thing that you can often see is with movement from standing off a chair, you may actually feel or hear a crackling sound, which indicates that there's some roughness or some irritation developing underneath the kneecap.
So Russell, what are the causes of patellofemoral joint syndrome?
Well, Graham, the causes can be multiple, but generally it's due to a pulling sensation where the kneecap is being pulled to the outside. So if any external causes are pulling the kneecap to the outside, that's going to cause uneven wearing and pain developing under the kneecap. Now, some of the reasons that we have for that are in women or adolescent girls which have slightly wider hips. We have the quads pull at a more lateral angle. Also, you can have problems with your hip joints being turned in too far, or poor stabilising of the pelvis and hip joint when walking and running. So what these things do is that they load up and put excessive pull from the outside muscles, and then you develop weakness of the inside muscles. And when you get that imbalance, you start to get excessive dragging of the kneecap to the outside and increased wearing and then symptoms. Other factors that could also cause that is if you have overpronation in walking, where your foot rolls in and the lower leg rolls in as well, which still causes a relative pull from the outside of the kneecap. Tight iliotibial bands are something we often see that cause excessive pulling laterally, and also tilting of the kneecap, so it's actually tight on that outside aspect. So we need to just be aware of what are the causes that can cause poor tracking that can be multiple and very varied.
So Russell, if someone has this problem, is there something they can do to manage it themselves?
Well, Graham, there are a few things you can do. The first thing is depending on where the pain comes from. If you sustain the pain in the knee from a direct contact injury, such as when playing sport, you'd rest from that activity, apply ice, and see how the knee settled down. It may swell up if it's an acute injury. You want to make sure that the injury itself is settling down, and you'll probably just monitor how the aggravating factors are going. What does it feel like walking, bending, sitting, and so on? If you find that the pain has come on through an increased athletic workload, manage that and see how much work you've been doing. Cut back a little bit, maybe avoid doing so much hills or downhill running, run on softer surfaces. Just modify your workload, back up a little bit, and then see if you can manage it that way.
So Russell, if this problem doesn't settle within a couple of weeks, what should someone do?
Well, Graham, this patella femoral joint pain can be a very persistent and debilitating issue, particularly if you're an active person who wants to maintain their levels of training and sport. So you need to probably consult your physiotherapy because, as I mentioned before, the causes of this is multiple. So you really do need to work out where this is coming from. It could be coming from, again, as I mentioned before, poor foot posture or imbalances in the way that the muscles are acting, causing that increased loading and lateral tracking of the kneecap. Early intervention is of prime importance because this, as I said, could become a long-term issue. So some of the things we'll assess when you come in is what is the relative imbalance around that kneecap. Very, very often we get excessive action of the lateral muscles pulling that kneecap to the side with a consequential inhibition and weakening of the inside muscles. We would assess what the relative balances are and also what the activity is of the iliotibial band, what your foot posture is like, and what the strength of the hip stabilisers are, all which can contribute to imbalance around the knee. So one of the things that we use, we found very effective at this clinic, has been the musculoskeletal assessment, which is a comprehensive assessment which takes in all the factors that may be contributing to your pain. And sometimes we find issues that you didn't even know were there that also could be part of the problem. We found it very useful, and I think it goes a long way towards actually managing what can be a debilitating problem. If you'd like some help with managing this problem or to book an appointment, call us at Northwest Physiotherapy Clinic, that's nwpg.com.au, or call us on 9370 5654 and we'll get on top of it as quickly as we can. Thank you.